My name is Dr. Ben Moshrefi, and I'd like to give you a little bit of information about how we operate at this office. We utilize the Gonstead technique, and the purpose of the Gonstead technique is to do the least, but you want to get the best results in the shortest amount of time. So we utilize the Gonstead equipment, which is the Gonstead chair, the Nisha table, the Gonstead bench, and we have the Zenith High-Low that we'll show later. We use Gonstead instrumentations such as different kinds of nervoscope. This is one of the older ones. Here's a newer one, the Delta T, to find exactly where the nerve pressure is on the patient. So the purpose is to find the problem, accept where we find it, and then once you find it, you adjust the area of the impingement, and then you kind of leave it alone and let the body do the healing. We know different body parts are linked to different nerves. Our endocrine system is directly linked to our nervous system. The bladder could be an L4. The thyroid could be around C6, C7. The heart and the lungs can be around L1. Stomach around L4. Sorry, T4. So it's important to understand that we do not treat symptoms, we treat the cause. So if the nervous system is compromised, could it affect our function? Absolutely, 100%. So treating the cause should be the most important thing. We also have to look at the body as a whole. We can't just try to narrow down and look at the area of the complaint, because it usually won't work. So for example, if you have knee pain and we start to look at the knee without looking at the spine, there's a big chance we might not figure out the source of the problem. Most of the time, each nerve is going to different body parts. For example, your lower back L5 is going through the back of the leg, and the upper lumbars go more towards the side of the leg. And sometimes the lower thoracic, like T12, they can go right to the knees, the front of the knee especially. To differentiate, it's a good idea to understand that the area of the pain usually radiates. So if it's a nerve and you have knee pain and the pain's going to the side of the shin or it's going up, could be more of a pinched nerve in the lumbars rather than the knee. A lot of time you go to the doctors, you go to the hospital, and they look at the knee and they look at the area, look at some x-rays, and they say, you have arthritis. And it's easy to blame it on the arthritis and the degeneration, but the arthritis has to be really bad for it to affect the area of the complaint, like the knee or the hip. You really have to be bone on bone for the area to be very painful. So it's important to get checked, take some full spine x-rays. We take the x-rays from the neck area down, all the way down to the tailbone and the hip area. We put the whole picture together to understand the whole spine as one picture. We'd love to help. If you have any issues and you've sought help elsewhere and you have not found the answers, our goal is to educate you so that you in turn can educate others. We'd like to help as many people as possible. Have a wonderful day, and hopefully we'll see you.